Today we're going to discuss motivational interviewing. Motivational interviewing is a directive, client-centered counseling style that works with the client to address ambivalence and create motivation in order to elicit long-term behavior change. What is ambivalence? Ambivalence is a conflicted state where you have simultaneously the opposing attitudes of wanting to change and not wanting to change, which creates a conflict. Ambivalence is common when there is a discrepancy between short-term reward and long-term adverse circumstances. So if we look at the example of exercise, there might be a short-term goal, a short-term reward of sitting on the couch being relaxing and comfortable, but long-term that can have some really negative impacts on our health, such as diabetes type 2, obesity, musculoskeletal problems, poor mental health, a whole range of issues. So in motivational interviewing, we want to work with the client to address those discrepancies and create motivation. A common response to patient resistance in this case would be to reiterate health advice, to adopt an authoritative approach and tell them what they're doing is wrong and trying to tell them how risky this behavior is. But research has shown that this can actually result in increased patient resistance, and research has also shown the value of motivation in the long-term behavior change. Before we look at motivational interviewing techniques, though, we need to establish the patient's readiness. Are they ready? Are they willing? And are they able? Basically, how important is this to them? How confident are they to change? And is it an immediate priority or not? We can look at the trans-theoretical model of behavior for this and divide the behavior into behavior intention and behavior itself. So again, looking at the example of exercise, we can look at behavior intention, including pre-contemplation. So basically, no exercise and not planning to anytime soon. So after asking permission, you can educate them about the risk of not exercising in order to increase their risk perception. We then move on to the contemplation stage where they're not exercising yet, but they're seriously thinking about doing it in the next 6 months or so. And you can work with them in this stage to explore barriers, what's stopping them from starting, and help to build their confidence. We then moved on to the behavior itself, which includes preparation. So they're seriously considering and maybe have taken a few steps. You can create goals with them to build more intrinsic motivation. You can help them prepare, such as joining a gym or a running club. We then have the action, so the exercise, and obviously continuing goals and providing positive feedback and reinforcement is really important. But then maintenance. During the maintenance phase, they've been going for about 6 months or so, continue those goals and the reinforcement. We also want to look at some relapse prevention strategies. However, relapse is a normalized process in motivational interviewing. It is taken as a learning opportunity. We look at what went wrong, what we can do for next time, what went well, and work with the patient to build their confidence in order to make a long-term behavior change. So now we can look more specifically at motivational interviewing. Motivational interviewing is a collaborative partnership. We acknowledge that the client knows themselves best and work together to resolve ambivalence. We also respect the client's autonomy, their freedom to change, and encourage the self-confidence and self-competence. And throughout the process, we really focus on the spirit of motivational interviewing. The spirit of motivational interviewing is collaborative, it's empowering, it's evocative, and it honors the patient's autonomy. Empowering, we ask the client what they feel competent in doing and try and build up their confidence. It's evocative, we activate the client's own motivation for change and evoke change. We elicit change talk and connect their health behaviors to their personal values and beliefs. It's also collaborative but directive. So we work together to create goals whilst respecting the client's autonomy. For example, if the client is stuck, you might ask permission and say, you know yourself best, but I can provide some advice based on what the research shows or what people who have been a similar experience have found. And this is the whole motivational interviewing process is underpinned by these principles to make a really collaborative therapeutic relationship where the therapist is a facilitator rather than an expert to make it non-confrontational. We also have some more principles that we can discuss to actually put motivational interviewing into practice. We can look at the acronym RULE, R-U-L-E. R being resisting the writing reflex, U understanding the client's motivation, L listening with empathy, and E empowering the client to explore and make their own choices. So what does this actually mean? Resisting the writing reflex is basically the tendency of health professionals to advise patients on what to do. What's for good health? You should be doing this. This actually is paradoxical because it can reinforce the argument and build up resistance and continues that ambivalence, and it's just not effective for the client. We also need to understand the patient's motivations. What are their interests? What are their concerns? What are their values? We really need to approach with curiosity and openly explore them, listen with empathy, and understand the potential barriers, but also the motivations for them. We then have listening with empathy, which is being attentive, open-minded, non-judgmental, really listening to their perspective, and even simple nodding and phrases like, I understand, and supportive, open-ended questions to really get the patient talking so you can properly understand them without you judging or overtaking. Finally, we have empowering the patient, which is to improve their outcomes. We explore their ideas, draw on their strengths and areas that perhaps they want to work a little more in. We want to make it really collaborative to build powerful motivation. And as the practitioner, you need to embody the hope that change is possible and that instill that hope in them that they can do it as well. We can also look at 4 additional principles with given time to basically look at the basic skills of motivational interviewing. We can look at the OARS acronym. O is open-ended questions, A is affirmations, R is reflection, and S is summarizing. We want to ask open-ended questions to encourage them to talk so we can better understand them. We want affirmations, compliments, appreciation, understanding to encourage them to continue speaking. Reflection, rephrasing what they're saying to us to encourage more exploration and amplify their desire for change. And then summarizing to demonstrate that you're understanding them, that there is a mutual understanding and that you have empathy, and also can prompt them to continue on certain conversation points. Some other important final points for motivational interviewing is goal setting, negotiating a change plan action, plan of action, what they're going to do. If there isn't a goal-directed approach, we find that ambivalence can be maintained. They're sort of static and don't change. So goals are really beneficial. We really want to focus on moving beyond that ambivalence and eliciting change talk. So what are the disadvantages of what you're doing at the moment? What would be the advantages of changing? And building optimism for change and their intention to change. You can address how important it is to them by simply asking, how important is this to you on a scale of 1 to 10? And if it's low, why is it so low? And if it's 10, all right, how can we put this into action? And then we can also look at their confidence the same way. How confident are you out of 10 to make this change? Why is it so low? Or if it's high, what are the barriers that are stopping you from starting? Throughout the whole motivational interviewing process, though, we need to make sure we maintain conduct within the spirit of motivational interviewing. We want to focus on establishing a collaborative, non-judgmental, and client-focused partnership. And if done correctly, motivational interviewing can be extremely effective in providing long-term behavior change that will benefit a client's overall well-being. Thank you so much for listening. Bye.